feel tired, lonely, depressed, no interest in life? Or are you obese? Do you have diabetes, high blood pressure? Do you know what the real cause is? Let's look back. Did you have problems when you were growing up? Were you abused, neglected, or did you have a family with a lot of problems? Do you know that could increase your risk for cancer, diabetes, heart disease? Yes. My name is Dr. Cooper Dockery, and welcome to Get Healthy. Get Healthy is a program designed to educate, empower, and inspire you to live a healthier lifestyle using lifestyle modification. So welcome again to Get Healthy with Dr. Cooper.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Welcome back to Get Healthy with Dr. Cooper. In our show today, we're going to be exploring many reasons why there's so many people in our society today who have diseases that are preventable. Diseases that the doctors are not necessarily treating the real cause. There's so many of us today who have problems that we're facing or problems we had in the past that's really affecting how we live and how we stay healthy. The topic of the show today is adverse childhood experiences. And I have a fantastic guest who is going to expound on how to identify whether or not you have a problem and how to fix your problem. Dr. Bryce, welcome to Get Healthy with Dr. Cooper.
Okay, thank you.
It's really a pleasure having you, Doc.
It's a pleasure being here.
So tell me a little bit about yourself. Where do you practice?
I am a physician in the Dallas-Fort Worth area, internal medicine specialist. I am board certified in internal medicine, fellow of the American College of Physicians, and a clinical adjunct assistant professor of medicine at University of North Texas Health Science Center. So I've been around the block a little bit.
I can see that.
Yeah.
You have all these accolades, right?
Well,
and you spend a lot of time taking care of people. Get into the real cause. So doctor, tell me a little bit about this topic, adverse childhood experiences.
well, it's best identified by asking one simple question. What happened to you before you were 18 years of age? In San Diego, a team of investigators discovered about 20 years ago that there is a large segment of the population that is being affected by abuse of different types, physical, sexual, physical neglect of different types, if you grew up with anybody other than your mother or your father, or a lot of household dysfunction. These deficits, dysfunctions, abuse, in turn is associated with a lot of chronic medical diseases. And these can be identified very easily by Googling, calculate my ACE score.
ACE score, right?
Right, Adverse Childhood Experience Score.
That's right.
And you can actually calculate and find out what your score is. And if you have 1, you'll find you have a significantly increased risk. If you have 4, you have a lot more. You get to 5 or 6 and you're in serious trouble.
Right. So if our audience are listening to us now, how can they identify if they are at risk? We mentioned that there are different types of adverse childhood experiences, right?
Right.
We have abuse, whether it's physical, emotional, or sexual. We have neglect. Some kids are just left alone, no love at all. And then, of course, problems at home. So how can you tell our audience how to identify whether or not they have high risk for diseases because they have had this problem?
The simplest way is to get one of those tools where you answer about 10 questions. And if you Google, calculate my ACE score, you can actually answer those questions and you see what your score is. That's the simplest way to do it.
That's right. Doctor, you are currently practicing internal medicine in your practice in
Yes.
Dallas. Now, can you give me an example of a patient that you might have seen who really had this problem that influenced their chronic problem?
It is unbelievable, quite common. Not so much in my practice, but I'm thinking of a friend of mine who weighs 300 pounds, even though she is very short. And she has tried everything in the book in trying to lose weight. She has diabetes, she has high blood pressure, and she just developed breast cancer. She's only 48 years of age. And one day she was explaining to me that at 9 years of age, her father just moved out. She grew up in a normal family, did well, and it wasn't long before her mother started on drugs. And the fellows who supply the drugs for her used their mother and used her from 9 years to 15 years of age. And that destroyed an organ in her body, not really destroyed, but create a situation where there's a dysfunction in what is called the amygdala in the limbic system.
Right.
This is very typical in a lot of situations. And that in turns create a situation that you find that you turn to some kind of a drug.
Right.
Food, alcohol, sex, you name it, to try to deal with this situation.
Right.
And so to solve this problem, you have to get to the cause.
That's correct. So I had a patient who walked in my office recently. So he was a middle-aged man. He had hypertension. He was overweight, and he appeared depressed. Actually, he came in on 2 different depression drugs and a pill for lack of sleep.
Right.
So I said, there has to be a problem. I asked him, tell me a little bit about what happened when you were a child. And you know what he explained to me? At age 9, I was sexually abused. And that was the real cause of his current problem. So friends, you might be listening to us and you start wondering, why is it that I'm so overweight? Why am I eating? Why don't I exercise? We need then to see what happened years ago. Am I right, Dr. Bryce?
Yes, I have one patient of mine, and he has given written permission to tell his story, that he took the score and his score was 0. He had diabetes, he had high blood pressure, he had coronary artery disease, and this did not run in his family. So I said to him, can you remember something that happened to you that was really traumatic? And so yes, he said he had wonderful parents, grew up in his family, everything was lovely, but one day he got lost on a scouting trail. And for half a day, he was out in the woods all by himself. He said he was terrified. He cried. He must have been around maybe 9, 10 years of age. That one traumatic event was enough to trigger off this cascade of situations that people lead up into this type of a thing. And so because of that, I'm telling myself, I can't wait for my book to come out.
That's
I
right.
need to get this information. How do you treat this? Because we're not treating this problem as physicians.
I agree.
And so people need to know how to do it for
I
themselves.
agree. So doctor, when can we look for that book?
Well, pretty soon.
All right.
I'm working on it, and it should be out soon, but we need to get the results out, that people can, simple things that they can do for themselves to find solutions.
Right.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain. Coenzyme Q for your health. Turmeric, the Wonder Supplement, great for joint pain. Vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
So then we're going to walk over to that table,
Okay.
and we're going to discuss some solutions, because I know that many of your viewers are trying to say, hey, do I have this problem? And say, what do I need to do? So follow me, Dr. Bryce, this
Yes.
way as we try to solve this problem. Because if the problem is not solved, we're going to continue to have a surge in diabetes, obesity, and chronic diseases.
Right.
All right. So then let's go to treatment. And we're going to look at the first one. What do we need to do? It says, find a trusted adult.
A lot of studies are showing that one thing that needs to happen is that the individual that's traumatized, somehow someone needs to intervene in this patient's life that is always there for that patient, the trusted adult. Oprah Winfrey just did a 60 Minutes on this.
Really?
And she made it very clear that it was her 5th grade teacher that was that trusted adult for her. She went through some of these abuse, physical, sexual, and all of that. And she's saying that that was that person. I know from myself, it was my grandmother who was that trusted adult. Now, this is very important that we recognize for small children, prevention is key.
That's right.
So we should create an environment for our children in such a way that we can prevent these occurrences. However, if this occurs and you find that you have this problem, that what we need to do, and I strongly suggest that we should find someone who can walk through life with this person, who is always there.
Right.
And for me, there's a spiritual connection. Knowing that there's a God, there's a Jesus who's always pursuing you, who can be that trusted adult.
That's right.
Okay? And he will always be there. There is a place where it says, if your mother and father forsake you, I, God, will pick you up and care for you.
That's right.
That's the trusted adult.
So I can see then, doctor, that you're a man of faith.
Yes.
So we're saying find a faith community. Find maybe a pastor. Find someone that will give you that resilience from a healthy relationship.
Right.
That is number one. Somebody you can talk to, somebody you can open to. It could be a doctor. I had a patient once, and he had severe depression. He also has high blood pressure. And after many years of treating him, he finally opened up to me. And he said, you know, doc, when I was young, I was abused by my uncle.
Right.
And then he broke down. But then healing started then. After you recognize and then find yourself someone you can really trust. All right, doc, let's do the second one. What is the second point?
Okay, the second part about it is you have to train the brain. The brain has to change.
That's right.
And so you go through what I call rehearsal to change the brain. And there's the first one I call gratitude therapy, or a situation where you think of the loving kindness of someone in your life. And mostly, if you stop and look, you can see where God has been working on your behalf to protect you in spite of all of this. If there's nothing like that, find some promise, some poem, something that shows love to you, and rehearse it. Rehearse it day and night. In my case, I found a place in the Bible that says, can a woman forget her nursing child and not have compassion on the child of her wound? Yes, she may. But I, God, will not forget you. You are in the palm of my hands, and your walls are continually before me. I rehearsed that since I was a kid, morning, noon, and night.
That's right.
So gratitude therapy, when you wake up in the morning, think of a number of things you can be thankful for.
That's right.
See, oh, God has been good to you. How life is good to you. You can either focus on the trauma or you can focus on the kindness and the love. So you keep rehearsing this to yourself over and over again.
So you need to find something that gives you hope.
Yes.
Because studies have shown that those people who are optimistic, those people that have hope, tend to live longer.
Yes.
So rather than thinking of the negative, you're going to focus on the positive. You have to retrain your brain, reshape the brain, and become optimistic.
Right.
See the brighter side of life. And that is going to actually help you to get over the trauma.
So as you think of the negative and rehearse the trauma, it further destroys the brain.
That's correct.
As you think of the positive, the gratitude to see how God has been good to you, if you keep rehearsing that, promises, I have loved you with an everlasting love. With loving kindness I have drawn you. You rehearse that, and it actually repairs the brain.
Fantastic. I tell you, studies have shown that those people who are positive, those people that pray and meditate,
Yes.
create a larger frontal lobe. So the mind, the brain is actually reshaped. Let's look at the third point to treatment. This is important. Why don't you start with this one, Doc?
Nutrition. See, what happens if you eat refined carbohydrates, white rice, white bread, white potato, pizzas, sugars, refined carbohydrates, sweets, sodas. If you do this, what happens is that the rise in blood sugar 2 hours later will create a crisis that in a way actually turns on the part of the brain that you're trying to turn off.
Imagine that.
So the trauma puts your amygdala into overdrive. The refined carbs puts you in a worse situation.
That's right.
So what you need to eat is what we call whole food. Like, for instance, whole corn instead of processed corn.
Brown rice.
Brown rice instead of white rice.
Unprocessed oat meat.
Oatmeal.
Oatmeal.
Like oat groats.
That's
instead
right.
of quick oats.
That's right. Quinoa.
Quinoa. So you eat this whole grain, 100% whole grain wheat instead of white flour. When you do that, it actually creates a situation where the amygdala gets turned off.
That's right.
And you do not put yourself in a flight and fight response, this adrenaline crisis every 2 hours. That is so important. The next thing is protein level.
Okay, before you go to protein, let's also talk about the need to have more tryptophan in your blood. That you're going to have from whole grain.
Right.
Tryptophan is necessary for serotonin production.
Yes.
And serotonin is important for happiness, to suppress depression and anxiety. So that is also important in terms of nutrition.
Nutrition.
Protein.
Now, proteins. The level of protein in the system and the level of fat in the system will cause a situation called insulin resistance. In the hypothalamus, where this hypothalamus overrides this amygdala that's overworking, the higher protein level you eat, the higher fat level, which comes from a lot of meat, the more high-fat meat and high fried foods that you eat will damage the amygdala. The insulin doesn't get to work. You lose control of your appetite, and your brain situation actually gets worse. And so I've found that the more you stick to plant-based, whole food, it's the more the brain will recover from this trauma. So unprocessed carbs,
That's right.
whole complex carbs, important. and this high protein, high fat, high salt, high sugar foods just put you more into the gutters.
So what we want everybody to know is that nutrition is indeed medicine. Because every disease that we discuss, we're going to see that consuming healthy nutrition will indeed be curative.
Right.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today.
All right, so what's the next one? Let's go on.
So the next one is physical exercise. Physical exercise is very important. Let me pause by saying, in going through these steps, the first thing you have to do is to decide that you want it for yourself.
Correct.
Doesn't make sense knowing all of this and you don't make a decision that I want to change my brain. I want to get out of this. I want a new life. I don't want to continue to die from diabetes, obesity, and all these different problems. I want a healthy weight and I want to live well. So you look at it and you decide that I'm going to find a group where I can find a trusted adult. I'm going to go to church. I'm going to join AA. Find some kind of trusted support system. Mm-hmm. And secondly, I'm going to change my diet. It's a decision. And now physical activity. Physical activity is more. When you move your muscle, you actually release a hormone called BDNF, brain-derived neurotrophic factor, which actually repairs your brain.
The other thing to Errol is that exercise increases endorphins. And what do endorphins do to you?
That's another good process.
That's right. That's the happy hormones. So if you're not moving, then you must move if you need to be treated from this adverse childhood experience, right?
Right.
Okay.
Physical activity also release GLUT4 transporter.
What's that? Don't make it simple, guy, because we don't have medical students here. What's
physical
that?
activities will release a hormone that when this release and it's into the blood system, it actually lowers your blood sugar.
Fantastic. Imagine
So by being physically active, you'll find you have a situation which actually counteracts, does the opposite to what the refined carbohydrates and the sugars and all of that. So the physical activity, physical exercise, be getting active, moving, every chance you get, I would say a minimum of 30 to 60 minutes a day.
That's right. And you can break it up.
Okay.
Guys, don't be afraid to break it up. 30 minutes in the morning, 30 minutes in the evening, or 10, 10, 10.
Right.
But just need to get the exercise in. Let's do numbers.
Before you move on,
Okay.
twice a week, you need some muscle building.
Okay.
Twice a week, along with your aerobic, you're getting that muscle building.
Right. So
Let's move-
physical activity at least 6 days a week, but twice a week. We're gonna
Physical
build some
activity, muscle building.
Excelente. Now let's look at the fifth one.
Sleep. Sleep is so important. It is during sleep that you actually repair your brain. And you want to get to sleep early, possibly before 10. 9:30 for me is the best time. And you want to get to bed with no food in your stomach. That means your last meal should be around 4 to 5 hours before you put your head down. So when you get to sleep, your body is working on repairing this diseased brain, this damaged brain, this abused brain. And you don't have to worry about digesting food when you're eating.
So going
you're
to
sleeping.
bed before 12, there's some hormones that the levels are going to increase. Melatonin and growth hormone, correct?
Yeah, fascinating. The melatonin hormone actually starts rising somewhere around 6 p.m. A little bit before 6 p.m., the melatonin starts rising.
When the sun starts going down.
Right. And it peaks at midnight and then quickly cuts down. So you want to get your sleep in as many hours as you can before midnight, when the melatonin is high, and you get your growth hormone surge also occurs early in the night when you're asleep.
That's right.
So getting to bed early is very important with your sleep.
Right. And now we're going to need to wrap up. Let's go to probably the last treatment option that we have.
So we have sleep and then service.
Very important for good health.
It's, as you make these changes, the way the body works, there is what's called a helper's high. Anytime you do something good for somebody else, the brain gets a rush of hormones that actually heals itself. Just doing something, one act of kindness, even a phone call saying, I'm thinking of you, doing something to help somebody actually changes the brain that will help you to get over the abuse effects of the brain. So helping someone,
right,
service, giving of yourself to somebody else.
It's medicine.
It's medicine.
You know, studies have shown that service or having a community is one of the health factors for longevity.
Yes.
Dr. Bryce, it has been a pleasure having you today. And I know that our viewers are happy listening to adverse childhood experiences and how this can actually increase your risk for so many diseases and early death. Thank you, Doc. I hope to see you again soon.
Keep up the good work.
Don't go away. We'll be right back.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
So you might be wondering why you're so sick and what are the experiences you had as a child. And you now know that these negative experiences can cause your disease process. You need to let them go. I am here to help you. I have resources, books with 9 secret pillars for good health, my cookbook that will give you all the information you need to stay healthy, and 14 days to amazing health with lots of information how you can change your disease process in 14 days. And most importantly, our Heavenly Father wants you to be healthy. In John 10:10, it says that the thief comes to kill, steal, and destroy, but I come that you may have life and have it more abundantly. Call the number on your screen today, and we will help to guide you to amazing health and longevity. I'll see you soon. Bye-bye.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonnacooper.com.